if your heart is in AFib 15% of the time, is that a lot? And part two to the question is, are antiarrhythmic drugs a good option to try before an ablation?
So 15% of the time can mean a lot of things. So if I put a 14-day monitor on someone and they spend 24 hours of that 14-day monitor in atrial fibrillation, that's one way of meeting that 15%. But another way would be to have hours of it multiple times a day. So some patients may find that one day every 2 weeks isn't a lot, but a couple of hours every day that adds up to 15% is a lot. So it really depends on what that 15% is made up of and what the rhythm's like during that 15%, because sometimes 15% is very fast and symptomatic, or a couple hours here and there, the heart rate's very fast. Even though you may be in atrial fibrillation for all of that 15%, some of that time in atrial fibrillation, the heart may not be going fast and it may be minimally symptomatic, or it may be always when a patient's asleep so they don't realize it. In terms of stroke risk, 15% is considerable, and if someone has the risk factors for having a stroke, 15% is more than enough to justify, in most patients, being on a blood thinner.